Hi, Casey, Hector.
Hello.
So today, what I wanted to talk about is kind of exciting. Hector and I, my assistant, have just gotten back from Tacoma. We've never been to Tacoma before, and quite a interesting place to visit. We've been to Seattle a lot, but this in Tacoma, the reason we went out there is to see Dr. David Clark, who is the pioneer behind, I would say, a movement in dentistry called Bioclear. Have you ever heard of Bioclear? No. So I would say within the next 5 years, a lot of people will have heard of Bioclear. And the reason I say that is because Bioclear has been a technology that has been driven by patients. So if you consider what's happened with Invisalign, that was patient driven because people didn't want to wear the brackets anymore and they wanted something a little bit more convenient. And when the necessity is there, innovation will come through. And now, as we talk about a lot, people do not want their teeth drilled on as much, right? So it has been something that the industry has noticed. There has been certainly a call for less destruction of a tooth in order to get something, let's say, aesthetic, or to close spaces, or to close what we call black triangles. Or do you know what a black triangle is?
No.
So a lot of times if you start to have a little bit of bone loss between your teeth, specifically maybe the bottom front teeth, and you're getting long in the tooth, let's say, this is an old term, I don't even know if you've heard of that. So, a lot of time my older patients say, Doc, I think I'm getting a little long in the tooth. What they're saying is as the bone and the gum recedes a little bit, the area that was occupied by gum tissue in between the teeth, now those spaces get a little bit bigger. And I've noticed that myself, not that I'm losing any bone, but just the gum is getting a little bit smaller. And you start getting more stuff caught in between your teeth, right? So you're at a restaurant and you're like, gonna have to go to the bathroom and get something out between your teeth, or you ask your wife, do I have a piece of spinach caught between there? As you get older, you get more of that. And these spaces are very unsightly, and people hate them. The question is, if you have perfectly good teeth, but you have these black triangles, do you want to get veneers to fix that? No, you don't want to have to do something as drastic as that unless you don't like the look of your teeth anyway. But let's say you like the look of your smile, you just don't like these unsightly black triangles. And you'll recognize it right away, and people who have them, I'm sure you know what I'm talking about. There is a better solution than doing a veneer to fix this. And we used to call it bonding. Another way of doing it that pales in comparison to doing it with a technique like Bioclear. And I'll try to explain more what it is. The other reason for Bioclear technique is if you have, let's say, a single tooth in the front of the mouth that is broken or discolored, and you're wanting to match the rest of the mouth. Oftentimes I would have to go in and do a veneer on 2 teeth just to get a proper match. Now with the Bioclear technique, I would certainly not do that. I would address one and be able to handcraft a restoration in the office that same day using my judgment, as opposed to having to take an impression and photos and send it to the lab and have a third party try to match the adjacent tooth perfectly, which is not going to happen. We would do it in real time, chairside, with my own eyes and hands, and be able to get that match perfectly, which is a huge value because you don't have to, first of all, do 2 veneers, and you would also walk out that day with the finished product, right? Did we do this before? Yes, we did. We did it with bonding. Again, we'll think of bonding as the little sister or the precursor to Bioclear, because bonding, you layer composite, you layer resin, which there are problems inherent with that, and namely the problem is strength. So what Bioclear has done, David Clark in particular, who's pioneered this, has used a lot of engineering principles to increase the durability of these restorations. So to throw out some terms that you learned with Bioclear, something that's borrowed from engineering: injection molding, stress risers, lithic approach versus a layered approach, things that are part of doing a Bioclear restoration. There's a whole different technique, and what's amazing is we've been using the same preparation designs with composites and resins that were designed for the old silver fillings, right? So it's like when I'm sitting there listening to lecture, the light bulb went off like in an instant. It's like, yes, why are we still doing preparations that were designed for amalgams, and we're applying these same principles to a completely different material altogether, right? Composite, the white material that I've been using for the last 27 years, is inherently different than amalgam or gold or porcelain. So you do not use the same ideas, the same principles to do these restorations as you did with those materials, right? So David Clark, who's a dentist in Tacoma, has looked at this and pioneered this way of doing these restorations to solve these issues that patients confront us with. I've had plenty of patients come in with space, let's say, between their lower teeth, what we call a diastema. And you're probably familiar with the term diastema, hanging around me so long, right? So a diastema is when a patient notices, "Doc, I don't like this space," different than a black triangle. It's actually a space between the teeth, and I haven't always had this. I've noticed it within the last 5 years, and they hate it. Now, some people like the space. Think of Michael Strahan, right? People will tell you if they like their space, and they will tell you if they don't. Most people do not like the space, but they also don't want you to drill down their teeth to correct the space. Makes sense. Didn't make sense to me before, because my only way to fix that is, okay, we'll veneer those two teeth. Because to bond those two teeth were difficult, and the reason why is you try to bond it, you're sticking a piece of resin between the two teeth. The patient will say, hey, one side's a little bit bigger than the other, or when I floss, I get the floss caught there, and I can also see where the composite starts and where my tooth begins. I'm like, I know, but I'm doing the best I can. I will tell you, with Bioclear, we can address those issues, and it's seamless. So a case in point, now this is a little bit more advanced. Just so happens, since we've learned this technique, and Hector and I went out and spent a lot of time learning this, we came back and lots of needs for this. Somebody who I diagnosed for 4 crowns and root canals, a young lady who had some health issues, a lot of acid reflux, was told she wasn't brushing her teeth right. I looked at her and in an instant said, this is not your fault. You have acid reflux, you're destroying your enamel. So she's lost a lot of volume on her teeth because a lot of the enamel's missing. It doesn't make a lot of sense to cut those teeth down more to cover them. That's what we would have to do with crowns. And believe me, crowns are appropriate for a lot of reasons, but there's not appropriate in this instance. But it was the only tool I had. And veneers were not appropriate because she had lost volume on the front and the back, and there was so much decay, it was more structural. So Bioclear is perfect for her. We were able to build the teeth back and make them look good again, because right now she had big holes in the teeth from the decay, and also build back the volume in an additive way once the decay was removed, right? So we still have to remove the decay, which you're going to be taking away tooth volume, but you don't have to take away more volume to cover it with a crown, which is what we would typically do, which would decrease the strength of the tooth. We were able to, through injection molding and the right matrices and the right prep design, add a monolithic material, that is one large piece of composite, not layered, to restore the strength of that tooth again. And it was nothing short of amazing to do this and to be able to not have to compromise her tooth structure. So in this case, the longevity of the tooth was brought up significantly. No doubt what she had was futile, was going to fail. And if we were to crown him, it would fail eventually. With this, I'm really certain it's going to last a lot longer than crowns. How long? I don't know. But a lot longer than crown, that's for sure. So there's a lot of applications for this. As I said, the black triangles, the diastemas, very, very weakened teeth that, in the case I just described, or somebody who has little teeth that before we may have done no prep veneers. Now this is an instance where you could do Bioclear as well. So the question is, Doc, are veneers and crowns going to go away? No, there is a place for each of those. So Bioclear we think of as a third place. You have veneers, you have crowns, and you have Bioclear. Is how we actually build the structure back. We put like a frame around the tooth, which used to be a metal band. Again, this metal band was the technology used with amalgam. The problem is this material is light cured. So it's difficult to light cure through the metal band. You can't. You have to do it in increments and thereby decreases the strength. So these bands are clear. They're a very strong plastic that is molded into the shape of the tooth, as opposed to a band that you have to try to shape into the shape of the tooth with your burrs. This is pre-molded and it's clear. So you can cure through it and get the strength in as opposed to layering it, put one monoblock of the material in, which is much stronger and doesn't incorporate air bubbles. And so that is part of the essence of a Bioclear technique, is the actual matrices themselves. They're completely different than the metal ones that we used to use that were designed for the metal restorations. So that's part of how that works, and a new paradigm, that's to say the least. And it's interesting that as much CE as I do, to stay on top of dentistry. And I guess what's happened is lately with COVID, we're a little bit behind, right? So this technology I probably would have been at 2 years ago. Now I get my head out of the door and like, what's going on? It's like, whoa, you stay out of dentistry 2 years, you're missing a lot. As you know, I do over 300 hours a year and I'm playing catch up right now. And so we've had so much fun since we've learned to do this, because ultimately who wins? The patient wins, right? It's a new technology where the patient wins, and of course it was patient driven, and that is the greatest thing about it, is patients have been asking these questions for years. Now we have an answer for them, and I'm very excited about Bioclear and offering this to patients, and so please ask about it.